Good afternoon. Welcome to the July session of the Hypertension and Cardiovascular Disease Interdisciplinary Echo Series. I'm Kathleen Wellman, the program coordinator for the Constellation Regional Collaborative Team. I'll be your echo lead for today. Jimmy Ellis is our quality improvement and outreach specialist, and he'll be monitoring the chat for us today. This is our agenda. We're going to do some introductions, have a presentation by Dr. Lackland, and some questions and discussions after. We're going to start with some introductions. I'll go ahead and call on the SMEs to introduce themselves, the Echo SMEs. I will ask that any of the participants that are here to please put your name, employer, and position into the chat so we can keep track of who we have. Let's go ahead and start with Dr. Lackland today.
Okay, again, great being with you. I'm Dan Lackland. I'm at the Medical University of South Carolina and do mostly epidemiology. I'm in the Department of Neurology, and we focus in on hypertension control and hopefully stroke reduction.
And Emily, I see you there. You're my next one on my box.
Hi, good afternoon. I'm Emily Ridley. I'm a clinical pharmacist with Prisma Health in Columbia, South Carolina. And I'm also done some work with PAHO with the Hearts in America. Nice to see you guys today.
Dr. Bretler, you're next.
Good morning, good afternoon to everybody. Jeff Bretler, I'm an internist and hypertension specialist from Kaiser Permanente region in Southern California, and also working as a consultant for PAHO. Nice to be here.
And Jametta.
Good afternoon. I am Jametta Magwood-Golston. I am the Health Equity SME for this work. I too am stuffing my face, so I will be on camera in a few minutes.
Well, thank you. We also have Sylvia Coleman, who is a consultant with our team here at Constellation, and Samantha Scott, who is a consultant. We would like to remind everybody to please mute your microphones when you're not speaking and to use the chat function for any questions and/or comments. Now I'm happy to present Dr. Daniel Lackland. Dr. Lackland is a professor of epidemiology at the Medical University of South Carolina. He's a fellow of the American College of Epidemiology, the American Society of Hypertension, and the American Heart Association. He serves as chair of the Oversight Advisory Committee for the American Heart Association Strategically Focused Research Network on Hypertension. He's also involved in population high blood pressure control efforts with over 300 scientific journal publications. He leads blood pressure and risk factor screening activities at sporting events in the Southeast and is a consultant for high blood pressure control programs worldwide and much, much more. Welcome, Dr. Lackland.
Great, thank you. Thank you, Kathleen. Thanks to everyone, and I also appreciate this opportunity to share a few things with you and kind of be a part of the team, we kind of hope. Our point today is to talk about the Carolinas, Georgia, Florida chapter of the American Society of Hypertension. And this is for those that aren't familiar, it's a 501c organization that's been kind of maintained for going on probably 33 decades now. And our mission is very similar to what your missions are, many of the things that you want to do. And that's kind of mostly an education and training and getting the proper type of information out for, in particular, the people in the Southeast, but we certainly have go well beyond that as well. Thinking about the components of the flow chart and the management of hypertension, what we want to do is to provide resources and parts that can help facilitate that. So a major part that the chapter does is in education and providing resources. Okay, we can move right on to the next slide. And a major part of that, just as all of you have listened to here today, I'm very familiar with what others are doing, bringing in that team-based approach. So when we first started as a chapter, new drugs, new classifications of hypertension medications, et cetera, and we were focused in on that. But now today, we're moving into something a little more, and in particular, the team-based approach. And how do we get this concept and get this direction across? And this has been one of our major focuses. And so we provide a number of education opportunities, we feel, to promote the team-based care and to kind of get that, just like each of you. I mean, this is modeled directly out of what Kaiser does and this. And so there's a great deal of familiarity that you'll have with this. But how do we get the team-based care approach for hypertension in places that this is a new type of concept? We get to rural, underserved type of areas. And so a major focus that we have is to build in this team-based approach. Of course, pharmacists, nurses, dietitians, community health workers, everyone, rather than the one single clinician that has typically been paired. So we want to get that message across. And the next slide, please. So our program overview, just a little more, just to kind of introduce what the chapter does. Our mission, like yours, is to improve high blood pressure control through partnerships and collaborations, providing education and training resources to all members of the hypertension team and into all areas. So we're clearly interprofessional and interdisciplinary. Okay. Just some of our example, this was just a slide, but this is just a few of the examples in South Carolina. We certainly put each of you on here too, so feel like you're part of this too. There is an initiative called the Hypertension Initiative of South Carolina, which is a line item on the state budget. Of course, the health department, South Carolina AHEC, there's a diabetes initiative of South Carolina. There are different American Heart Association chapters in South Carolina. And for reasons we'll discuss later, World Hypertension League is a big, is a good partner. So our focus is to bring the partners together and to kind of build some consensus and do some education and training with a central mission. Okay, next. Our strategies, we have produced a number of what we call learning modules that I'll go into a little more detail. We truly feel like we've put together this network of providers and building in the education resources so that to our providers, something called the Comprehensive Hypertension Guide that we'll discuss more. The World Hypertension League newsletter contains an education component that we do, and just with our relationship and from an economical type of standpoint, we provide the Journal of Human Hypertension to providers that typically would not be normal recipients of such a scientific journal. We work with different clinics to develop protocol development parts in our groups. We also identify the clinic hypertension team, and we think this is a little bit better. I heard Jeff say very appropriately being the hypertension specialist, and that used to be the big diagnosis for an individual to be a hypertension specialist. Then we recognize, I guess, centers of excellence, clinics of excellence. Those are all right there. One of the things that we're experimenting from the chapter is to recognize the team, not necessarily the individual, which we try to recognize in some capacities, and not necessarily the clinic, but the team. Do you have that team that's been put together? And we would recognize that team as opposed to just the individual, something that we're working in. And then we try to also support hypertension initiative, different pilot projects about. Okay. One of the big focuses, just like yours and ours, that we really have to put a lot of effort into is emphasizing this sustainability. we try to work with things, but we want to make sure that we sustain these different components. We want to make sure that there's an enduring capacity as well. So with the hypertension management, we want to bring in this value-based care, shifting the methods in different types of care, that team approach. We want to try to develop a shared expense model with primary care clinics. We don't implement a payment plan, but we try to be an advocate for different payment plans. And so while there's a lot of volunteerism in the world, we want to also emphasize the importance of that there needs to be a good reimbursement. We try to work in that kind of capacity. We want to demonstrate, again, the impact, in particular, of looking at rural and vulnerable populations. Again, looking at that shift by payers. We certainly try to develop, we do best when we have data that get the feedback. And so we work with different groups about that are focused in on the data collection aspect of it. Including things like hearts and this kind of packages that you're familiar with. The outcomes that we evaluate ourselves on, certainly just like everybody, our disease control data that we bring in and kind of consider, particularly in the rural and vulnerable populations. And just this little idea of knowing hypertension prevalence and that undiagnosed, it's not quite enough just to know the prevalence. We want to build in the people that know their blood pressure and know their blood pressure values and know what their blood pressure values mean is one of our major themes. Okay. The tools that we do, we continue to try to make the tools available to anybody and everybody as best we can. We're constantly trying to identify and recruit clinics. And we're an open group right up in here. There's no obligations or anything. If you'd like to be associated with, if we have resources that we do, boy, have at them, they're yours. We think about our operational needs and the tools. Again, these are blood pressure management tools, things like hearts, all the stuff that PAHO is putting out, all the tools. We just kind of want to make those available, and again, trying to bring everybody in there to be guideline compliant, at least as far as the teams are concerned. And again, our promotion of the hypertension team, and that team is including coordinators, the medical director, of course, nurses, pharmacists, everybody that's part of the team, including the medical assistants, the people at the door, but also the administrators. So we try to bring in the business side of this part too, making them part of the team. And then certainly we try to evaluate and help with education and training with regards to the logistics. And again, our evaluation, we want to help the clinics, the team, how do they evaluate it? So we have a large component of how does an individual clinic and an individual team evaluate their success, and how do they report their success, that we'll talk a little bit more about. Next. We are focused, just like you are, focused in on predicting what the impact is. So we have implemented a very important and enduring education programs that will always be available. We try to constantly update, but we want to make the education programs enduring, not just featured on one particular time or a period or something like this. We want this to be over an extended period of time and enduring. So this could be a source that a person or a clinic could come to and get this information as quickly and easily as possible. And this would be their source to come to us into the future. Very important, we try to emphasize what are the proven evidence-based programs, what's the best practice that we can put there. But most important, for all of you recognize this too, how do you implement this and sustain this with low cost? The olden days when I'm an old guy. So in the older days, 20, 30 years ago, you'd go into a clinic and say, okay, here's $50,000. We want you to implement that. And that was great. But then when the $50,000 dried up, everything dried up. So nothing was sustained. And you had some great programs, effective programs, but when the money dried up, wasn't there. So what we would try to do is to focus on things that we can do that have low cost and can be sustained at a low cost type of piece. We try to also work with programs that are applicable for all clinics, basically regardless of resources or profiles. And this is a little bit similar to what we say with the World Hypertension League. Pick out something that works for you based on the risk for your patients, but also based on the resources that you have available. One example that all of us know about is we go into a clinic, and if you think about the importance of white coat hypertension, masked hypertension, and the need for the out-of-clinic blood pressure measurement. Many of us have always been very familiar and loving towards 24-hour blood pressure monitoring. It's absolutely great, wonderful, love it, everything else. Totally impractical for a lot of our clinics that see vulnerable populations that are in rural areas. It just doesn't work. So what we try to do is to try to work and see what's practical, what can you implement for your particular clinic in your particular setting, like y'all do too. So it's very similar. Next. Our objectives, this is just some, but these are the ones that kind of stand out to us in this first piece. We support the implementation of evidence-based protocols for accurate blood pressure measurement and also self-measured blood pressure. And we promote that as a major activity, recognizing that this is South Carolina, North Carolina, Georgia, and Florida. The prevalence of hypertension, as you well know, is right at the 50% mark for adults. So we just can't do it. We can't sustain something like that without good, accurate blood pressure measurement, and important, certainly the out-of-clinic blood pressure measurement. And I know y'all know this, but it's one of our top field. We also identify clinical champions within each clinical entity that to help lead a team-based approach, kind of peer mentors or peers, to use this to show this has worked for us, want to implement this here, and kind of doing very, very similar to the things that ECHO does and everything, that same type of thing, bringing in situations that individuals can relate to. A lot of times you can't relate to the ivory tower, but you can relate to other clinics that have been successful, and that's what we choose to do. Also, we look at a strategy to implement all the members of the clinical team. And again, this is a little bit new compared to what we used to do. We used to we had a CME program, and we brought people together, and they saw it, and they dealt with it, and that type of piece. Now we're looking at how do we do the whole team, perhaps without going to a particular site. We still do some of that, but we would maybe not do quite as much of that, where we're going to a site, where we're going to there. And how do we build in education materials and also taking advantage of the new technologies that we have? Next. A major issue, again, bringing in from the guidelines that we do have, the proper methods for accurate measurement and documentation of blood pressure. This is one of our key parts like this. We partner with PAHO, who's got some great things of, one, identifying the materials that are there. We do this a lot with World Hypertension League. What's the best device? What's the proper training? How is someone accurate? What do you do with that measurement? What are the environments? What are the pieces that you have? Also incorporating self blood pressure measurement, where they're reporting this information back into the medical record, and hopefully being used in the management of hypertension. So that accurate blood pressure measurement that's trusted by the hypertension team that's out of clinic. This is an important issue that we develop. Okay, next. We have, for one of this, we have an online education series. We've we're well over 100 of these modules. They're enduring. They're readily available through the South Carolina AHEC platform. It's just our partner in doing that. That you would be able to get on all types of topics delivered by the true authorities, on the people that really have written the papers and written the books. Okay, next. A little more about this. This is the way how to do it. This is the South Carolina platform here, and these are mostly relatively short videos. In some cases, they're the traditional PowerPoint. In more cases, it's more of a discussion that we would have, and you would see this. It's an easy type of a click type of thing. You can do it anytime that you would choose to do it. Their modules or the descriptions are all listed out like this. This is just one, the management of hypertension in primary care, building on effective teams and implementing change in your practice. Easily picked up. These are for continuing education credits, if you would like to do that and to kind of listen in that capacity. Okay, next. And this is just one more additional example of what you would see from this particular one. This would be that management that we just got through looking at. You would click onto this and you would see that this series, if you will, would look like this. And in this type of case, you have the title of it, the management of hypertension, and building an effective team and implementing a change. The faculty that you have off of this, Don DePetty, that y'all know very well, myself, Michael Weber from New York, and Paul Welton at Tulane. Here's a description of this part, and here's the objective. So you're able to look at this, pick it up very, very quickly. It's clearly very self-pacing. Stop, come back, do whatever. The total package here is 1.25 instructional hours, 1.25 didactic hours, and you get credit for it. And the thing that everybody, and this is my little face on it to it, that's there. The thing everybody wants to see is it's free. It's free to anybody. Build it in here, and then you get the credit accordingly. Okay, next. And this is just a little bit more kind of describing what this piece is, building it forward, collecting it in here, and you just kind of go up here and collect and check it that you want to that you register for this forward. Okay, next. We also, if you look at the individual presentation, so you just saw the full module. So here is the very specific module that deals with this. And this is one more that you would build in here. You might not want to look at 4 of them or 3 of them or series. It might just be one that you're particularly interested in. So you work your way down. And so here is this next one, the critical importance of reducing undiagnosed hypertension and increasing high blood pressure control. In this one, it's myself and with Dan Jones here, the learning objectives. And the point here is you can just go click directly onto this one. So you can look at a full series, just look at one and get the same thing, or put it together however you would choose to do. Okay, thank you. The evaluation off of these modules, just kind of bringing in some of our partners here that we work with. But part of this, there are 4. There's a post-test, just like most everything else there, with multiple choice in here. There's a certification, 70%. You get that, you get a certificate, and again, you build in some other things. Traditional, getting credit for doing it. Okay. Another piece that we think is we do have a very strong partnership, probably for obvious reasons as you look at something like this. World Hypertension League, past president, currently the editor of the newsletter. And so what we built into this is we wanted this to be an education, not the crazy things just for the science people, but something that's really here, and to have different types of sections and pieces that are focused in on practical examples. What we look for are things that probably don't get published in the scientific literature. but something that you've done something really kind of neat. And you want to get that out at kind of a best practice or a little bit piece of. We would like the newsletter to be that type of forum. If you'll go to the next slide. The newsletter is free, just like everything else. And these are some of the featured sections that we have. So we look at it and look at a hot off the presses. We have people that would say, this is a neat article that might have implications to people that are really doing the work, that are really on the ground. Right? What might be useful? They write that out. A section I'm particularly excited about is what we call hypertension on the ground. And this is an example of what somebody's done and implemented that they've developed a little bit of success for. They were able to promote something like this. There's regional news in the traditional way, something that's here. And here's one specifically to what we're talking about here from our partners. So PAHO comes in and says, these are two things that we think your readership would like. We're all over the world. It's a free newsletter to any and everybody that wants it. And so we have, I think, a pretty good leadership. And this is just another little bit selfish opportunity maybe for me, but also something that this group might be interested in. We have something called the Children's Art Program. And this is where individuals, these are children that share their artwork. And we do this around World Hypertension Day, which is May 17th, by the way, every year. And so what we do is ask children to submit some artwork that's focused in on prevention, typically cardiovascular, stroke prevention, maybe hypertension, but they put it in art. And we ask them to display it right up across the top in their native language, World Hypertension Day 2024. It's what we just saw most recently. And so they put that in there. And unless you're really savvy and being able to read a lot of different languages, you might kind of miss that. And you might not get what that's about, but you can look at the artwork and you can see this. And it's really got kind of exciting. We started out with this, we've done it now for several years. We had almost 500 submissions this past year, and it's increasing. And people are already asking, what can we do next year? So it's kind of getting young people involved really early and building it in. And plus, all of the artwork is sponsored. So Echo, PAHO has been a great partner. Everybody knows some children somewhere that can do some type of artwork with it. And so you get recognized with your sponsorship of the individual, and then the artist, everybody wins a nice certificate. And it's just a nice way to put it together. What we want to do is to put this artwork together and make a series of banners that people can put and display at different types of events. Okay, next. And this is just a little bit more about this. This is kind of a World Hypertension Day focus like this. We recognize this all over the world, but this is also something that we can clearly do just about anywhere. What did you do? Recognizing something like World Hypertension Day and sharing some of this information and stuff that's coming out. And we think, again, this is about the newsletter being an education component. Okay, next. And our journal, again, we've spoken about the official journal, World Hypertension League, Journal of Human Hypertension. There's a lot of great journals. Not kind of promoting, but in this one, we have some opportunities. So if there are individuals that aren't currently getting a scientific journal focused on hypertension, they would like to, the chapter likes to be involved and try to help in that direction. Okay, next. And this is one I'd like to hit on because I'm really excited about it. And the chapter was instrumental in starting this this up. This was based on, some of you that are older that might remember, American Heart Association had the hypertension primer, and it was a book. And the goal out of it, and it just, you had all the smart people and they wrote a chapter in it. And it might be physiology or drug therapy or risk, everything else. And they got the great people put it together. And it was a big old thick book. And it was just pretty much everything you wanted to know about hypertension. And there were 4 versions of the hypertension primer. And the goal of it was to have each provider eventually to have a copy of the primer as a resource book to put on their shelf. And this was given out and distributed, where, and again, more than you ever care to ever know. The books had a $65 value, and they were given out for free, and they were sponsored by pharmaceutical companies. So put it all together. Somebody came up and said, no, that's it. Now you end up on you end up on a list, and somewhere people didn't do it. So it kind of stopped. And then there was a big gap of this information. So with technology and everything else, we thought to resurrect the guide, the primer, but put it into into newer ways. Now, make it electronic, So we sponsored this, and this is a series of modules with the same theme. In this case, where you had the people that were really focused in and knew this area really well, and they submitted a chapter in this and designed it to it. You could get the same continuing education credit and building this piece forward. And so if we go to the next slide, I'll go very quickly to kind of looking at the content. This is the guide. Again, it's based on an extensive curriculum of clinical hypertension and disease. Again, provides the evidence-based, not guesses, really things, the pathophysiology, the diagnosis, the treatment and prevention of hypertension. And it's designed for all the members of the healthcare team. Clearly, some of it's not going to be of great interest to all the members of the team, but there are parts that are really applicable to every member of the team. It brings in, again, all the resources and putting it together in a very, very reasonable manner of presentation. Okay, next. At the successful completion, you get a certificate and you get recognition. And plus, you're kind of members of, this is a long-term resource book for you, but you also get the credit for it and the recognition and the certification. One thought would be that if you completed this, we feel like you have the competencies associated with some of this type of evidence. That's a real nice thing, is you're identifying a particular team or a particular individual and looking at a network of people that you know have these have these skills and these components of it. Okay, next. This is just looking at it again, kind of building in the one of the sections, the fundamentals, foundations of blood pressure, looking at the physiology, the pathophysiology, the epidemiology, the pharmacology, the clinical trials, and the genetics. In that particular one, this is just an example. You have 185 minutes, and this is just a snapshot of the version that you have. Next. Diagnostic evaluation, just giving you an idea of what it is. Don't worry about these dates. This is my idea of putting together a slide. But it looks, again, blood pressure measurement and stuff. All materials delivered by the really people that truly understand this and carry it forward. Okay, next. Secondary hypertension, same type of title. I think you get the overall theme. You could pick this out, do this part. You've got a resource book now that covers all of this information, and this is just another. Okay, next. Treatment, the different treatment modes. We're on our second version. The third version will correlate with the new guidelines that are coming out. So we want to keep it updated and different types of materials just to bring it out there. Okay, in the next area. Next, a treatment, special conditions, resistant hypertension. You can see what these different pieces are. The guide covers this pieces. Okay, next. And I'd like to share one of I mentioned we had a pilot project as well. This is just one of the things that we brought out. Okay, next. And this was a project where we were looking to see, could we go in rural clinics provide, we provided in this case the Omron 700 device that had Bluetooth capability, asking this question: can this information make its way into the health record of an individual, that they would be able to kind of look and would be used into the management piece of this. That was what our piece and our direction that we want to do, and also to kind of certify that hypertension team in this particular area. So if you'll go to the next slide. And we kind of wrote this up and kind of came in here looking at, again, this hypertension on the ground, going back to the newsletter, and called it the self-measured blood pressure monitoring and clinical support among adults with hypertension, a pilot project. Okay, next. And we used, again, the Omron 7 series, and that doesn't matter. I'm not advertising a product here, but this was advertised that this would be something that we have. So they gave it to select patients to see if this could make its way back in. Next. And the approach, again, we gave out 50 of these. The process, again, was to look to see if this could work and make its way into the Epic Health Record. Okay, next. And their early results, patients loved it. They loved having something, and they seemed to measure blood pressures that they liked. The patients reported the blood pressure using their smartphone and internet, those that had it. Those that didn't have it, though, brought their devices actually into the office, and it was downloaded almost in minutes or less than minutes into Epic. And the clinical team said they trusted the values that were there, and they actually managed and titrated the doses based on those pieces. And the issue, though, was that these monitors only included the adult and large adult cuffs, not the extra large cuffs. And so therefore, most of their patients, or half of their patients, were hypertensive, so they weren't able to do something. Next. And so the device that was recommended was the wrist device that some of you have seen from Omron. We said, okay, and we gave that out there, and they liked that, but the providers, I think appropriately, didn't trust that value to treat blood. It's useful for saying, is my blood pressure going up or down? But to manage blood pressure, the wrist device was not satisfactory there. So, and this is just one example of one of our pilot projects that we did. Okay, next. And this was the wrist device. Next. Again, the considerations that we came out of something like this was that you wanted to use validated devices, and you wanted to, in this particular case, want to get another cuff fit to go with it. Okay, next. And this is one I'm kind of excited about, particularly also that we're involved with our awareness and community engagement, that we think is very important for this hypertension team, and to provide forums or to recommend forums that we have. Okay, next. One that I'm really excited, we call it Strikeout Stroke. We're actually scheduled to do it tonight if it doesn't have a storm. The piece, if you go to the next slide, and this is kind of exciting. Here's the team. Each year, these are all volunteers. And I'll tell a very, very quick story. We go there and you measure blood pressure and give out materials. In this group, you can see, boy, a little bit of everything. In here are deans, department chairs. We have attending physicians, residents, medical students, regular students, nurses, pharmacists, almost all the members of the team that all kind of come together. And I share this, just a real quick story. You're going to come out today. Today, it's going to be at least 90 degrees. And you're going to come out and you're going to sit there and you're going to show up with me about 6 o'clock and ask people if they want to get their blood pressure taken. And they're going to get their blood pressure value, and you're going to just talk to them about it. No diagnostics here. We know we're not looking at this. We're not taking names or anything else there. These are folks that are just getting out there involved. And I was thinking, if I added up the price, some of these on the folks on the very left there that you're looking at, those are department chairs. That's the chair of ENT and the chair of medicine. On the other side, we have OBGYN, just all kinds of folks and providers that are here. And I was thinking, if I added up how much you got per hour and what you would get paid to do something like this. And they're not getting anything except a t-shirt. So I'm figuring that turn on this event, and in each year that we do this, it gets bigger and bigger and bigger. And this is just one team. Tonight, it will be even bigger. People come out, give us 4 hours of their time, and the impact is fairly good. If those of you that are into the clinical trials type of stuff, and the number needed to treat, the number needed to screen, boy, for the price on this type of stuff, it's that if we find one person and we get them just where their blood pressure is a little bit high, boy, this one's really, really big cost effective, and people just kind of love it and kind of bring it in. So it's one that we're kind of excited about, and I appreciate you allowing me to share this with you one more. Okay, next slide. And this is just one more of us in another type of group, just really kind of excited. And this, okay, next. And again, you can tell I have a passion. Okay, next. And this is one that we have. Sometimes it rains. And at first, you're kind of bringing it in here. And so we've got this rain. Everybody's kind of there. But we stayed. And I think that's the kind of neat type of stuff. And our theories was, we're not going to let rain. You're more important. The people that are participating are more important than if it's raining or not, that we will do it. And next slide. This is there's a rainbow there if it's not too difficult to see. Kind of just a little bit of fun I was having with this. Y'all can see what my passion is. And next slide. And here we are again, just with the same group. After the rain, we stayed and brought it in here. And I think it sent a really kind of a great message. Okay, next. And we do this, and you get a koozie. We try to do this on what they call Thirsty Thursday. That means you get two beers instead of for one, and so we give you a koozie, and it makes it fairly attractive. And so people say, well, why do you do it on those nights? Those are the people. You're going to get all the old hypertension people like me. We would come on other nights, but I kind of know my blood pressure and I know what's going on. Of course, you want to see me. It's the people that don't know what their blood pressures are, the people that haven't been diagnosed with hypertension, and that's the undiagnosed. And that's what we try to kind of focus in on this type of an event, just to have. Okay, and next. And there we are. So thank you. I went over and I apologize.
Oh, you are fine. Thank you so much, Dr. Lackland. Such an insightful and informative presentation. We now open up the chat for any questions or comments. We'll do about 5 minutes of questions and comments if there are any.
Dr. Lackland, I have a question. When you said the undiagnosed, what happens to those people who find out that they are hypertensive, and they have not gone to a primary care physician or anyone of that sort? So the volunteers, or do someone recommend them to maybe get it checked again and so forth? So can you answer that for me?
Jimmy, thank you. That was a great plan. I want to tell you, that's the tremendous question. And that's why it's so important to have all the members of the team. And we're not enrolling or anything else there like this. And I wish I could tell you, oh, we don't have any of those people. Boy, no. In fact, we got a lot of those people, and that's what we feel bad. They sit down. Now, granted, you're at a baseball game and it is hot, and you've just finished off your third beer of the night and a hot dog and everything else there. So that could be playing a role. So what you do is we'll take your blood pressure and tell you what that blood pressure value means. And then we say, you need to talk to your doctor about this. It just might be the environment. You might be doing great, and it just might be the environment that you're in. And we share that, but you need to talk to your doctor. And then they say, I don't have a doctor. Well, you saw all those people there. There's some people that are there, including our administrators. Boy, that's what they do. They tell you, this is where you can go if you don't have a doctor. Do the things that we all do as part of our job and doing it there. Now, we're not out there recruiting patients for MUSC or anything else like that at all, but we're trying to help facilitate where they would want to go with the undiagnosed. And I do appreciate you doing this, and I can share with you this information. About a third, or 20%, a third of these are what you would consider to be the undiagnosed hypertensives. They've never been told that their blood pressure is high, yet it is kind of high. Certainly some of those, it's the environment, that kind of stuff. But there's a significant number of them that we find that aren't diagnosed, don't know that they've ever been told have high blood pressure. And to your point, they don't have somebody to go to, and we bring it in. Of course, if it's one of the emergencies, which we have on occasion, we had one, I'll go quickly. We had one person that sat down, and one of the students, residents, said, I'm upset. This blood pressure is 260. So what do you think? Just like me, you think, oh, the equipment broke, dadgummit. So I go in there and pull out another machine, but we're using good equipment. And it measured it again. It's still in that type of level. And so I told the individual, I said, I'm sorry, we got to do something. I can't ethically, morally, or any other reason possibly let you go. He said, oh, my doctor knows this. Yeah, I bet. And he also had AFib, and he's sitting there. He's got his son with him. And I said, I'm sorry, I just can't. I said, I tell you what, though, if we call your doctor and your doctor says, yeah, that's fine with me for him to have a systolic blood pressure of 260 and go up there and sit, I said, I'll let that go. And this was just luck of the draw. This was this was an MUSC patient. So we called the doctor. One of the people on the team actually knew the doctor, just called him up. He says, no way. So tell him I'll meet him at the emergency department in 5 minutes. And we got him under, and he got under control. So those really kind of good success stories are things that we kind of like. One more, Jim, and I know you had a simple question that I could have answered simply. We had one of the people in that first photo was a professional football player, a Hall of Famer, and called us up and said, I see this. My mother died of a stroke. I want to give back. What can I do? And I said, why don't you come out here, sign some autographs, or just kind of participate with us, because it's a team approach, and it's just amazing. This is actually a fun thing, a very, very pleasant thing. And y'all can see I'm passionate about it. Apologize if I'm going over, but thank you for that.
Thank you so much, Dr. Lackland. If there are any other questions or comments, you can definitely put them into chat, or I will have an email address in just a few slides that you can contact us with, and we'll get those questions answered for you.
Kathleen, may I, just because we have some folks here who are from North Carolina, and I know that there are some strong roots of the American Society of Hypertension in North Carolina. Dr. Lackland, is there, and thank you for such a wonderful presentation and for sharing your passion. Is there anything in particular to our folks from North Carolina? I know Rebecca put into the chat, she loved the community engagement. They do a lot of that, and we've done Strikeout Stroke here in North Carolina. So I just wondered if if you could just share a quick example or two for our North Carolina team members.
You mean how you could relate to this? Is that the question?
Yeah, well, and I know that they can relate because it's Carolinas,
Sure.
Georgia, and Florida. But just so that they know, I know a lot of the history, but just so that they know, just quickly, and that there are some very strong roots in North Carolina that we've
Ab-
done strike out stroke here too.
Absolutely. The chapter is crosses over, and we are 100% inclusive. So if you'd like to be a part that's there, we will hopefully to if you're doing some of those neat things, again, go back. That the newsletter might be a good forum for you to share some of that kind of information, because a lot of us, me too,
Absolutely.
a lot of the stuff is exciting and we're great and we feel real good about it, but it doesn't make its way into resources where you kind of get something published or whatever. So we would certainly want to we're very, very inclusive. If you send me an email or Sylvia, you can take an email or any of this kind of stuff. There's been a long
Yes,
history,
absolutely.
a long history of, again, we started out as the Carolinas chapter American Society of Hypertension right after the turn of the century, and then worked that way, and then started to include Georgia and Florida in there too. But certainly, this is the heart of the chapter.
Thank you.
Thank you so much, you guys. As a reminder, we are still looking for cases to review during the future ECHO sessions. If you'd like to submit a case, Jimmy will be putting the link for the REDCap form into chat. We look forward to seeing you all at our next ECHO session on August 22nd. And our own Jametta will be presenting then on social determinants of health. Please visit the iEcho platform, even though we're not using that for the meeting, and go ahead and go on in there and complete your session feedback form. That way you can receive your continuing education credit for this session. And we remind you of the email address to reach out to us if there's any questions or comments. And on behalf of the whole Constellation Regional Collaborative team, we thank you for joining our ECHO session today. We hope that you guys have a great rest of the day. Thank you again, Dr. Lackland, for the amazing presentation.
Always. Thanks for the opportunity, guys.
Thank you, Dr. Lackland. Have a great day.
Always.